Welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. April is Parkinson's Awareness Month, kind of a renewed sense of urgency to help raise awareness about Parkinson's disease and hopefully to find a cure. With us today are Christina Korines, diagnosed with young onset Parkinson's disease a year ago, and with returning guest, Mr. John Lehr, CEO of the Parkinsons Foundation. They're joining us to talk about her case and how the foundation is making life better for folks with Parkinson's disease, or PD. Welcome to the program, both Christina and John. Thank you so much for returning.
Thank you very much.
Parkinson's Awareness Month. How long have you been involved with Parkinson's Awareness Month as CEO of the foundation?
So April is the month in which James Parkinson's first identified Parkinson's disease 200 plus years ago. The foundation has, acknowledges it along with a lot of other Parkinson's disease organizations, and it really is a key time for us to just talk about Parkinson's and raise awareness of a disease that affects more than 1 million Americans.
More than 1 million. And you being one of those affected, Christina, how does your Parkinson's diagnosis differ from other Parkinson's diagnoses?
Well, I think everybody's diagnosis is going to be individual to them. I know for me it was difficult getting one because I have a 2-year-old and a 6-year-old, and, I'm 33, and, you have such a long, long life to live, so you get it, and you're like, what is my life going to be like? I have such a long, long time with this, and, you learn to live with it, you try to make it positive, and you make the best of what's been dealt to you.
So it's called young onset or early onset Parkinson's. Is that the differentiating factor there?
Yes, I've heard them both used.
So basically you're just living your life and you started having, I guess, some of the classic symptoms of PD?
I did. When I was 22, so about 11 years ago, I started with a tremor. And my boyfriend, who's my husband now, he started noticing that it was progressively getting worse. And I went to, I think, at least 5 or 6 neurologists. And then finally last October, I went to NYU in the city, and I finally got my diagnosis. But I have all the classic symptoms that an older person would have with the same disease: tremor, difficulty walking. Sometimes my sense of smell doesn't work. Any classic symptom that an older person would have with Parkinson's, I have it as well.
Now, I'll get right back to you with basically the question that I'm going to ask John. In your opinion, what is it about Parkinson's that caused her to be diagnosed so far out from the first, maybe year of noticing problems, John?
Yeah, so, Christina's case is very unusual. The number of people who have young onset or early onset Parkinson's is less than 10%. And so, we are doing everything we can to understand why somebody like Christina would end up with a diagnosis. It's unusual. And, she's bringing the right attitude and the right spirit to it. She's doing all sorts of great things to keep herself healthy, like exercising and boxing, and she'll probably tell you about that. But our goal at the Parkinsons Foundation is to help develop new therapies, both clinical therapies and new medications, so that people like Christina and anybody diagnosed with Parkinson's can live life to the fullest.
How has some of the networking efforts that you've been involved in helped folks?
Yeah, so we, the Parkinsons Foundation has what we call our Center of Excellence Network. This includes 42 institutions, some of the best academic medical centers in the country, where we're collecting patient data in a database called the Parkinson's Outcomes Project. This is allowing us to look at the care and the outcomes of individuals like Christina over time, to discern better treatment modalities, and then to raise the standard of care and disseminate that broadly, so that, when Christina goes into a doctor's office, he or she, the doctor, is providing her with the best standard of care, the most up-to-date therapeutics.
Christina, when you were going to your doctor or doctors, was there something that caused them to maybe misdiagnose or not catch certain things, or maybe dismiss certain things that you and your then fiance, now your husband, were trying trying to tell them? Was that something that was going on?
Well, I think the difficult thing about Parkinson's is that it doesn't show up in any testing. There's no images that will show up with it. There's no blood work that you could really do. And I was 22, and I remember I went to this one neurologist, and I walk in, and he's like, well, I could tell you it's not MS. He goes, but I can't tell you it's Parkinson's. He goes, but I can tell you if it is, you'd be in the Guinness Book of World Records.
Wow.
And he kind of made a joke about it. And I'm like, well, that's not very comforting. And then I must have heard that about 2 or 3 more times. And then finally, when I went into the city, my doctor, he saw me walking in, and I saw him stop and walk behind me. And I'm like, why is he watching me walk like this? And he knew right away. I think the difference is, and I don't know if this helps any other people who are going through this, is I saw a general neurologist, and then I went to a movement disorder specialist, which was this incredible doctor who specializes in, these disorders. And he saw my tremor, and right away he's like, this is Parkinson's. And, I think it's just a matter of finding someone who specializes in what you're going through.
Now, obviously, a huge impact on your personal and your social life. You used to teach middle school, and I understand you're engaged in a little bit of boxing now, or maybe a lot of boxing. Talk about that just a bit.
Oh my goodness! I always say it's the only time I feel normal. I started boxing with this trainer. His name is Mike Cooper, and he's fantastic. And he'll watch me. He watches me from the parking lot. He'll be like, "Oh, you're limping today," and he'll make sure that I walk out of there and I'm not limping anymore. And he works with me one-on-one, and he uses these mitts, and he'll call out combinations, and it's the only time. Parkinson's slows you down. And he'll tell me, he's like, you're so fast today, and it's awesome. You feel, and I use this term all the time. My husband's like, why do you say that? I'm like, I feel normal. And I remember one time I said it in front of my trainer. I said, I feel normal today. And he's like, you are normal. He's like, don't ever say that to me again. And it was just great because he doesn't treat me any differently. He pushes me, and it makes me feel like I don't have this. Sometimes it feels like you're dragging your body, and with the boxing, and you just feel incredible.
As John mentioned earlier, nearly 1 million folks here in the United States alone are living with PD. This number is expected to rise quite a bit by the year 2030 to 1.2 million people. John, where can we learn more online about Parkinson's disease and the Parkinson's Foundation?
Thanks. You can go to our website, which is parkinson.org, or you can call our helpline, which is 800-4PD-INFO. That's 800-4PD-INFO.
Christina, John, a pleasure. Thank you, Christina, for joining us today. John, thank you for returning. I'm hoping that we'll talk to both of you again in the future.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at hpr.fm, and you can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and visit our affiliates page at hpr.fm.